Good morning, everyone, and welcome back to day 2 of 2020 IPS conference from California. It's great to see everybody. We got folks slowly trickling in. I am Chris Llorente, IPS trainer with Alameda County Behavioral Health, and I am one of the moderators of this conference. I'm going to turn it over to our first set of presenters, Geoff and Renee. If you two could just introduce yourselves, give a little bit of background, and then take it away.
Good morning. Thanks, Chris. Geoff, I'll let you go first.
Yeah, hi everyone. My name is Geoff Evans. I'm a benefits counselor with Alameda County Behavioral Health Care Vocational Rehab. I have been doing benefits counseling for about 7 years or so. I was previously working with community-based organizations, contracted, and I'm directly over here at the county. So yeah, I'll hand it over to Renee.
Good morning, everyone. My name is Renee Renteria. My title is Client Benefits and Accounts Manager with Alameda County Behavioral Health Care. I am part of the Billing and Benefits Support Unit. I have been with Alameda County for about 24 years. Started as an eligibility worker with social services and then transferred to behavioral health care about 17 years ago. So happy to be here today and talk about the complexities of benefits management when employment comes into play. So thanks for having me. Perfect.
So I think we're going to start with just a brief overview. A lot of times people are not aware that there are two different types of Social Security disability benefits. So I'm going to go over some information about the difference between those two different programs and how to identify which program somebody is on. And then we'll talk about how employment and income impacts those benefits. The ways to maintain those benefits, and then sort of just provide guidance on how to navigate these rules around income and assets when somebody returns to work. And then we will shift towards the medical benefits side of it with Medi-Cal and the various categories. So the next slide, please. So one of the easiest ways to figure out which benefit program you're on is to see what day of the month you're receiving a check. So SSI is always received on the 1st of each month, whereas SSDI tends to happen on the 3rd or a number of other days. But basically, if you're getting a check on the 1st, that's SSI. If it's on any other day, it's SSDI. So SSI eligibility is determined by an individual's income and assets, meaning there are means testing component to it. In California, it always includes Medi-Cal, and it has a asset/resource limit of $2,000 per month. And that is the part of the means testing aspect to it. SSDI, it's basically the eligibility is based on your work history. So SSDI is in many ways much more similar to Social Security retirement. We all pay into Social Security with these FICA taxes. And it's a sort of contribution throughout your whole work history, and that determines your eligibility and typically the amount of cash benefits that you receive. SSDI, like Social Security retirement, includes Medicare, but it takes, this is after the first 2 years. If you're under 65, the Medicare insurance kicks in. And you also might be eligible for Medi-Cal as well if your income is below certain thresholds. The other huge difference between SSDI and SSI is because SSDI is similar to retirement, it's in a way a kind of pension that we all pay into. There's no resource limit, so there's no asset limit. There's no means testing component to it in that sense. But if somebody requires having Medi-Cal insurance as well, there are some resource limits. Thankfully, they have just recently been raised to 130,000 for people in certain circumstances. So that's a huge difference and will open up eligibility for a large amount of people. Can we move to the next slide, please? So the way SSI changes when you work, there's a particular type of formula that they use. But the easiest kind of way to determine that is approximately half of what you earn from employment will impact the amount of cash SSI benefit that you will be eligible for. So under this example, let's see, Hector only receives SSI, so he's only on SSI and is earning $800 per month from employment. The wages he earns will impact his SSI benefit amount 2 months later. So wages, for example, wages for October will impact the amount of SSI received in December. And the reason for this is that they do give you a few days grace period to report income. So for example, if in this situation, if Hector was working in October, he technically has until November 5th to report that income to Social Security. So obviously that's after he had received his SSI check for November, and that's why there's a little bit of a lag time. So it doesn't affect the cash benefit amount until December. So using the SSI countable income formula, in this situation, Hector's gross earned income is $800. There are these two other exclusions, an earned income exclusion and a general income exclusion. So that equals $85. So that would subtract the countable income from 800 to 715. And then they apply this the rule where they only count half of that, so it becomes $357.50. And then his SSI amount for adults in 2022 is $1,040.21. And then they would subtract these countable wages from above the $357.50. And then that reduces his SSI cash amount to $682.71. But the key kind of takeaway in terms of incentivizing work is that he's keeping his income from his job. So the SSI amount goes down, but he's keeping the income from employment. And so those add together to increase the net amount. Can we move to the next slide? Now, SSDI is a very different situation. There's a couple of different sort of phases of how they deal with people returning to work. So the first part of it is something they call a trial work period. So they've created ways for disabled individuals to work and continue to receive SSDI. And so one of those incentives is called the trial work period, and allows you to test your ability to work for up to 9 months. And usually for an additional 3-month grace period, they're still sort of waiting to see, watching the individual to see if they're maintaining that employment. And during that time, it doesn't impact the SSDI benefits at all. So you're still going to be receiving the full SSDI amount and keeping all of your wages. Now, the threshold for how they count down these 9 months of the trial work period is basically any month when your gross earnings exceed 970 this year. And then with this upcoming COLA for next year, they're going to raise it to 1,050. But if you're self-employed, it's working over 80 hours per month. Trial work period months don't have to be consecutive. So in a situation where somebody's income is fluctuating, that trial work period actually could last quite a bit longer than 9 months. So if somebody's working 1 month and maybe not another month, or sometimes they're making more than other times, it could last quite a bit longer. So, if your gross earnings are under the threshold amount, SSDI benefits will not be impacted, and that month won't be counted towards that trial work period 9-month total. Now, once somebody has used all of those 9 months of the trial work period, you enter into an extended period of eligibility. They usually use the acronym EP, which lasts for 36 months. And during that time, if your monthly gross earnings exceed something they call substantial gainful activity, SGA, the amount threshold for that is $1,350. And again, that's going to raise next year to $1,470. That is the sort of absolute limit, and you will not be eligible for SSDI payment for that month. So unlike SSI, your cash benefit amount does not go up and down based on how much you're earning. You either get all of it or none of it. So it's a different sort of calculation that somebody needs to make about how employment is working out for them. So when the 36-month extended period of eligibility ends, your SSDI benefits will end if you're consistently earning over that substantial gainful activity amount of 1,350. So again, that's a scenario where you get all of it or none of it in terms of your SSDI benefits. But during 5 years after those benefits end, you still sort of remain in this period where you can request to have your benefits reinstated for up to 6 months while your disability is being reevaluated. So meaning you don't have to start all over and begin the whole process of being determined disabled again to start getting SSDI payments again. And that can be a very important thing for people that are navigating, returning to work. And what they call this period where you can have it turned back on without reapplying, they call that the expedited reinstatement. Can we move to the next slide? And so something that's really important, particularly for SSI, but also for SSDI, is that when you're working, they need to know about how much income you're making. So reporting income is required for people who receive SSI and or SSDI. There's a number of ways that they allow you to do that. You can mail it. Mail in paycheck stubs, bring in the original pay stubs to a local Social Security office. You can fax them. But if you're dropping them off, you always have to request a receipt to prove that you reported your income, because sometimes these things get lost, obviously. So you always want to have some sort of record that you fulfilled that responsibility as a beneficiary. And one thing also to smooth the process is to make sure when you're reporting income, you need to write your Social Security number on the paycheck stubs, because a lot of the times they'll just receive some sort of fax or mail and they don't know what's going on with that and who this person is. So to expedite that process, they can just, if the Social Security number is on there, they'll just immediately look up that individual beneficiary and enter in the wages for that person. Now, there are some people also that some beneficiaries that they'll allow to use the supplemental security income telephone wage reporting. So that's only for SSI. And there's also the mobile wage reporting system also has a app for smartphones, which is super convenient. And obviously that's the easiest way to report income. It takes 2 minutes, once a month to do that. But they have their own criteria about who they will allow to use that system and who they won't. So it's always a good idea to contact Social Security to confirm what manner they want you to report the income. And here are some phone numbers to contact Social Security. Move to the next slide. So now I want to hand this over to Renee, as this is her specialty. It's the medical insurance.
Thank you, Geoff. Yeah, so I'm going to go over a little bit about Medi-Cal, although there are quite a lot of complexities when it comes to insurance coverage and the impact that employment can have on certain individuals. And depending on the status that you're in, what kind of benefits you're receiving plays a big part of that. So for SSI Medi-Cal, you're receiving SSI benefits, so you automatically have Medi-Cal linked to that benefit. SSI and Medi-Cal, although your SSI benefit amount may be impacted by your employment, your Medi-Cal really does not get impacted right away, which is a little bit different than the benefits portion of it. As Geoff explained and you saw, SSI money piece is impacted immediately. Medi-Cal can continue as long as you're still eligible for some amount of SSI benefit. In addition to that, you can continue to get Medi-Cal benefits for a short period of time after you're no longer eligible for any SSI funds. And that time period I've seen vary anywhere from 6 to 12 months, and it's typically pending a reevaluation of eligibility by social services. That eligibility is known as Craig versus Bonta, so that's the legal terminology behind the special program that you could continue to be eligible for Medi-Cal benefits once your SSI benefit stops. The other type of Medi-Cal is aged and disabled federal poverty level Medi-Cal. This type of Medi-Cal is the type of Medi-Cal coverage that covers individuals who are receiving SSDI and no SSI benefit. So for individuals receiving SSDI, that Medi-Cal coverage is for disabled individuals or 65 and over who have less than $130,000 in resources and less than $1,563 in countable monthly income. So this is, again, for SSDI recipients only. That Medi-Cal really is not impacted by your SSDI no longer being active, because that Medi-Cal is administered through social services. When you start working while receiving SSDI, typically that will impact your Medi-Cal by resulting in a share of cost. So that means your SSDI income plus your wages that are being earned will be counted and evaluated to determine what your monthly share of cost for Medi-Cal coverage will be. That monthly share of cost is very similar to a deductible. So let's say, for example, I have a $500 monthly share of cost for Medi-Cal. That basically means that I do not have Medi-Cal coverage until I meet that share of cost. So if I receive any services from a physician, I have to pay the first $500 towards those services before Medi-Cal will pay anything else. The good news is once that happens, there is a special program that not many people know about. It's the 250% Working Disabled program. And if you meet the criteria for that program, which is again under the resource limit, which thankfully this year was raised to $230,000. Previously it was the same as SSI resources, which was $2,000. If you meet the asset test and your countable income is less than 250% of the federal poverty level, which is $2,831 per month, which does not include your disability income. The only income counted for that test is your wages. Then you could qualify for the 250% Working Disabled program, which will then eliminate that monthly share of costs that you have through Medi-Cal. So there are definitely ways to keep your Medi-Cal benefits while you are working. One of the things, however, that we are seeing an increase of recently is individuals who actually have never been determined disabled, excuse me, and currently have traditional Medi-Cal, not the disabled federal poverty level Medi-Cal, but Medi-Cal that's known as Magi Medi-Cal, which isn't determined by age or disability. And once they begin working, they exceed the monthly limit for that type of Medi-Cal, and their Medi-Cal will then end. And since they have not been determined disabled, they don't qualify for the working disabled program. So that's kind of an anomaly that we're seeing since this new, during the Affordable Care Act, Magi Medi-Cal that came into play. People who have not been determined disabled and are eligible for that type of Medi-Cal, there's a more difficult way to keep benefits intact if you start working. And next slide, please. So we're also wanting to provide everyone with some really good resources. The Social Security Red Book is sort of my go-to whenever I have any questions in regards to how wages and employment will impact both SSI and SSDI benefits. It's a really great resource to use. It's very large, long, lengthy PDF, so I don't recommend printing it if you go to the link to take a look at it, but it has a lot of really good information and a lot of detail in regards to the different levels that, like Geoff mentioned, the trial work periods, the extended period of eligibility, and the expedited period of eligibility. Social Security Program Operational Manual System. This is Social Security's policies and procedures, and if you ever want to know anything about how they determine different things that can impact your benefits, this has everything you would ever need to know. Disability Benefits 101 is a great resource for disability benefits and working with disability in California. Center for Independent Living is also a great resource. And then I have listed here my email and Geoff's email. We're always happy to help if any questions come up and any complexities that you may face. Next slide, please. We are now ready to open it up to questions.
All right, we have one question in the Q&A section. So everybody who is viewing this, if you have a question, please go to the Q&A section and type it in there. The one question we have here is if someone works past 5 years, then something happens and they need to get back on the SSI or SSDI, do they have to start the process all over again?
I would say like typically that's the case, but you know, it's also the caveat that it's still going to be a different scenario than somebody who was never receiving benefits before. So, you know, they still have records, right? That somebody was at one time disabled and they have records on what that diagnosis was and what the work history was. So, yeah, you do have to kind of start the process, and it's going to be a lengthy process, but it might not necessarily be as kind of arduous of a situation as when somebody first applied to get on these benefits.
All right, another question just came in. How does someone get linked to the Working Disabled program?
That's a very good question. So the Working Disabled program is also administered through social services. So if you have an eligibility worker assigned to your Medi-Cal case, you would want to request to be screened for the Working Disabled program through that eligibility worker. I will mention though that unfortunately, since this is not a very well-known program, a lot of eligibility workers aren't very familiar with it. So it's not something that you will automatically be screened for if you report that you are now employed. It's something that you definitely have to specifically ask for.
Okay, another question here. Can you tell us what the Social Security Red Book is, and will Social Security mail you a printed copy of it if you request?
So the Social Security Red Book is very, very lengthy and detailed information of all of the different complexities of employment and how it impacts both SSI and SSDI. I've never asked them to mail one. Geoff, I don't know if you have, but if you pull it up online, you can download it into a PDF copy. I don't know that you would want to print it. I think it's over 100 pages. So it's very long.
It's also pretty difficult to find an answer to your question if you had a sort of just a paper copy. So it's much easier to just do a search on the online version for whatever particular question you might have. Because as
That's a
you
good
can
point.
imagine, there's a million different situations that somebody might want to find some particular information about.
All right, and we have a question here from Marjorie. Hi, Marjorie. Do most IPS programs have a dedicated licensed benefits specialist, or do they contract with outside firms? And can you talk to us a little bit maybe about training that's available to become a benefits counselor?
So in my experience, no, there's not very many benefits specialists, and I don't really know why that is. I know there is a WIPA program where one can be trained to become formally certified as a work incentives benefits counselor. DOR, Department of Rehab, usually has benefits counselors. And then obviously county mental health services usually will have somebody that has some kind of specialty. And then occasionally, similar to my position when I was previously at the Center for Independent Living, there would most likely be somebody who's knowledgeable about benefits at independent living centers. So that's always a really good resource wherever you live, to find the local independent living centers that are there to provide services for people with disabilities. And that's a really good place to start if you were looking for somebody that is knowledgeable about those things.
Also, and I don't know if you mentioned, Geoff, if people are connected with the California State Department of Rehab, typically they have a work incentives planner on site as well, who is specifically trained and certified. And there's also the Cornell University also provides training and certification for benefits, although it's high level and generally focused on federal benefits. It still touches on SSI, SSDI, but you got to remember that entitlement programs, there's so many of them out there, even down, not just at the federal level, at the state, at the county, and even at the local level. And they're all so nuanced and have their own specific rules and so it really somebody to kind of roll up their sleeves and get in there and really understand the nuances and the rules and the regulations of all of these things.
Yeah, that's a very good point to remember, that there's very wildly different programs in different locations, like state to state. So knowing a little bit about the federal benefits is good, but how those are implemented on a state level are going to vary wildly. So occasionally I've talked to some people in different states where they have some questions, and I had to usually do research to find out kind of how they did that in Nevada or how they did that in Arizona compared to California, and you find that there's some really, really big differences. So it's not really a sort of one size fits all kind of situation.
All right, we have another question in here. Can you talk to us about the benefits of being Medi-Medi? So that's Medi-Cal and Medicare.
Yes, so Medi-Cal, Medicare, if you have both, you basically have, simplest way I know how to describe it is you basically have dual coverage. Your Medicare coverage is your primary insurance coverage. So any services that you receive that are Medicare billable have to be billed to Medicare first. Any services left over after that can be billed to Medi-Cal. There are actually quite a bit of benefits of having both Medi-Cal and Medicare. Medi-Cal covers a lot of the co-payments, or Medicare may only cover 80% of a service. Medi-Cal will cover the other 20%. Medi-Cal will also screen you to see if you're eligible for your Part B premium to be covered by the state in California. So that's another benefit of having both. And there are usually quite a few of special program coverages that you may be eligible for things such as in-home support services, if you have both Medi-Cal and Medicare.
Want to add anything there, Geoff?
Yeah, I would say that, that's kind of an important thing to realize. So Medicare, covers 80% typically, but that can leave pretty extensive copays for some people. And, like Renee mentioned, in-home support services, that's a scenario where that can be prohibitively expensive. So that's a scenario where somebody having Medi is going to be essential. Or if somebody has, prescriptions that are extensive kind of regimen of prescriptions that are extremely expensive, even the copays might be, arduous kind of thing to deal with. So having Medi, provides more like comprehensive coverage for scenarios with people with disabilities. And so that's typically why, many people with disabilities are on Medi, because there's maybe some different kind of special needs in terms of medical services and support services.
Very good, thank you. So most, if not all, of the entitlement programs out there are means tested, right? Meaning, you only qualify based on, income or certain asset limits. You guys talked a little bit about asset limits for SSI, and thank goodness SSDI has raised the ceiling on that. But what are some ways, that folks can, maybe get around those asset limits? In other words, how can folks protect, protect or shelter money and avoid those asset limits?
Yeah, so that's a really good question. And up until not too long ago, there really wasn't a whole lot of options, but thankfully there is something relatively new called an ABLE account, ABLE, and these were a particular type of bank account is designed for people that are on means tested benefits that will allow you to go above these asset limits, particularly for the SSI and Medi-Cal side, where you can only theoretically have $2,000 per month. These CalAble bank accounts will allow you to save up to $15,000 per year. And then there's an additional amount that's allowed if that you can prove that balance is coming from employment, from income. So this is a huge game changer that will allow people to save money. There are a couple of caveats. One thing, technically, you have to have been disabled before you were 26 years old to be eligible to open one of these accounts. But I know that there are people lobbying to raise that because it does unfortunately leave out a huge portion of population of people with disability. But for the time being, it is 26 years old. And then the second caveat is that these accounts, you can't use the money in those accounts for anything other than what they call qualifying disability expenses. But what that really means is kind of everyday living expenses, including obviously anything to do with your health and any kind of out of pocket things that you might be paying for your health. So you can use the money for most of the things that most of us spend our money on a monthly basis, but there's certain kinds of things that are deemed to be kind of frivolous or unnecessary that you can't use those funds that you have deposited in the CalAble account towards that. And the problem, if what happens if you do use the money for something that isn't sort of qualified or allowed, is that that can kind of trigger a back sort of ineligibility, and then all of a sudden the assets are counted, and then that can result in an overpayment of a sort of retroactive overpayment of SSI or SSDI. It has to be done very carefully, but the takeaway though is that you can get around those assets, as Chris mentioned, using the CalAble account. And then there's also something called a special needs trust. So there's a particular type of scenario where you have to hire a lawyer who specializes in these particular type of trusts, but that can be another way to shelter, if somebody inherits some large amount of money, or perhaps like gets a lawsuit settlement, and that can be another way to do it. But be aware that that does obviously cost. You have to pay for the legal fees to draft up this trust, and it also involves having a trustee, and so that's sort of similar to a kind of sub-payee situation where there's another individual who is sort of legally responsible for managing those assets and resources.
And I would just add to both of those. So for the CalAble account, I'm glad you mentioned, Geoff, there are things that you have to be really careful with how the money is withdrawn and spent, if it's for an SSI recipient. So there's a lot of rules around that. In addition to that, it is audited by the IRS. So you want to make sure that you keep all of your documentation of money's deposited, money's withdrawn, and how that money was used. For special needs trusts, I agree that that's more of a for somebody who has inherited a very large amount of money. Special needs trusts also are very restrictive on what you can use that money for, even more so than CalAble. CalAble accounts are much more lenient on what you can use the funds that you deposit into that account.
Okay, everybody, reminder, the Q&A is open, so please get your questions in there. We got few more good ones here. Beth is asking, all right, so we've seen this one. If someone is applying for benefits or appealing a determination that they've been denied benefits, and they're going through a work program like Department of Rehab or enrolled in IPS services, does seeking work harm their chances of benefits going through, even though this is a program? These programs are designed to help people on benefits get back to work.
Yeah, that's a complex question that I get all the time. And the simple answer is yes, but there's a sort of caveat that what a lot of people don't understand about being sort of determined disabled is there's two aspects to it. Okay, one of them is medical or psychiatric, right? You have to meet certain diagnostic criteria, but the other one is financial. So you also have to, that diagnosis and those symptoms have to also prevent you from consistently being able to earn substantial gainful activity. So both of those conditions have to be met for Social Security to determine that you're disabled. So that, with that sort of in mind, if you're applying for SSI or SSDI, but you're also sort of working at the same time, they're definitely going to say, well, why do you need these benefits? You're working. How are you disabled if you're earning income? So, the short answer is yes, that's going to be a problem. But there's also sort of failed work attempts are strangely considered evidence of a disability. So if somebody's working for short periods of time, but they can't sort of sustain employment for a longer period of time, they do see that as evidence of somebody having a disability. And also, the amount of income you're making, that is also a big factor. So if somebody's working a little bit and they're making under that substantial gainful activity amount, they're also going to sort of take that into consideration when they're determining whether somebody's going to be awarded SSI or SSDI.
Renee, your thoughts, your experiences?
I agree. Yeah, no, the short answer is yes, it definitely can negatively impact the appeal process and just the initial application process. You have to be very careful.
And I think really the important point is, throughout all of, this process and this consultation, what we're really trying to do is enable people to make informed decisions for themselves, right? Just kind of put all the information and all the facts out there and say, here are the pros and cons, of either direction you want to take. It's up to you, and we'll help you noodle through that and weigh those, but ultimately it's your decision on which route you want to take. All right, next question here is, someone who has SSI also have a 401k through their jobs?
That is going to be counted as income and an asset, unfortunately. Now that's a scenario where, the things that we mentioned before, with the CalAble account or special needs trust, that there's a possibility to kind of cash that out and deposit it into a CalAble or open a special needs trust. But those are really the only ways to sort of shelter that from being counted as an asset. So, that's one thing to keep in mind with SSI and certain categories of Medi-Cal. The means testing is very severe in that way, and that they just do not allow any way around that other than, those options that we mentioned earlier.
Good, and we have a question here, Melvin. Is it possible, can you back the presentation up to there we go, with the resources on. Fantastic.
And I think we might have missed one. How do people qualify for dual medical insurance?
Yep.
That I just noticed
Mhm.
there. So if that's specifically in regards to Medi-Cal and Medicare, the Medicare piece of it is still the same criteria as mentioned earlier. You have to, if you're under 65, you have to have been receiving disability for 2 years, or if you're over 65, you qualify for Medicare. And for other types of insurances, it is possible to have insurance through your employment with Medi-Cal and Medicare, but that then becomes your primary insurance coverage. So if your employer offers Kaiser coverage, then Kaiser is now your primary insurance coverage.
Probably should also mention that, for like in a scenario where somebody was on SSDI and had Medicare, and then eventually returns back to work, there is a period of time where you can keep your Medicare, even though you're no longer getting cash benefits. And basically you just end up starting to pay the premium yourself rather than having it deducted from your SSDI cash amount. So you can opt for that. So that's sort of an option that if somebody, has a particular network of providers that they're working with that are also based around kind of accepting Medicare, and, a lot of people will, choose to do that. You can keep your Medicare for a certain period of time. So, that sometimes is a good option for somebody who's kind of transitioning from, being on SSDI cash benefits into working full time. And that might give them a sort of buffer zone to where then they can kind of feel out, what kind of medical services they're still receiving, what kind of providers they need, and then think about the process of, do they want to move towards a HMO or PPO through the employer, or do they want to get another plan through the market, through maybe Covered California, depending upon their income, or do they want to stay on Medicare for a period of time? So there's many different options, and it can get kind of complicated, but it's a good thing that you have this sort of buffer period where you can think about that and kind of investigate.
All right, another question here in the Q&A. If a DOR participant is trying training while in the Social Security application process, is there an issue with the application? So let's maybe say paid and unpaid training. Talk about both scenarios.
What paid? Yeah, I mean, there is obviously all income is counted. There is something called a pass plan that is rather complicated, sort of way that sometimes they will allow people to keep receiving SSI while they are training, going through a rehab, vocational rehab, but there's very particular process, and it's an extremely complex and long application process. And there are very, very few of these past cadres. This the sort of weird language they use for the specialists for the past plan. So it's not something I recommend. I've helped a couple of people with those things, and it was just an endless source of kind of frustration and having to respond to that and try to get in touch with the cadre and provide information and get feedback. And so in reality, that's the amount of time you're wasting and energy to do that is not efficient at all. You could be making way more money working. I mean, the benefits themselves, that's bad enough, just dealing with the normal rules associated with SSI or SSDI. But then when you get into these past plans, it just becomes absurd. And maybe at one time that was functioned in a different way, but I think it's in many ways kind of a relic of an earlier era that doesn't really make sense anymore.
All right, another question here. Okay, I think we talked about that. Can you share with us some of the most common pitfalls that can be easily avoided with just some upstream planning and some intentionality around, the benefits and the wage earning aspect?
Well, the most common thing that I've seen among hundreds and hundreds and hundreds is the failure to report income. So, and then that creates this scenario where there's these overpayments that happen, and then you're in debt to Social Security, and this snowballs to where, then you're having to pay back Social Security. And most of the times they're taking that out of your monthly check, so your benefit amount goes down. And then maybe somebody's working to compensate for this lower amount of cash that they have, and then they fail to report that income again, and it just gets bigger and bigger and bigger. And then people usually don't understand why that's happening, and then all kinds of strange theories develop out of that then people tell other people. So I spent a lot of time trying to kind of just go, no, it's not some huge conspiracy. There's very simple rules that for whatever reason Social Security doesn't really explain this to people, and it's baffling to me, like, why they don't do that. It's always some sort of footnote, deep buried in some huge letter that they sent you, that in some kind of language it's hard to understand. But that's the number one thing to be aware of, is just report your income once a month, and that removes most of the problems. SSDI is a little bit of a different scenario, where they might actually deliberately tell you, like, oh, we don't need it, it doesn't matter, particularly if you're in your trial work period. They're just like, whatever, we don't care what you're doing. But then the other problem with SSDI is, because of that, they're not looking at your case. The way SSI, you're being sort of surveilled, on a regular basis. But SSDI, they'll ignore you, and it can be years until some case manager looks at it and goes, oh, this person has been making over substantial gain for activity for years, and now owes us $30,000 in overpayment. And that happens frequently. So, for somebody on SSDI, you have to be really proactive, and sometimes even, somewhat belligerent about it with Social Security. You have to say, no, stop my benefits. I know I'm not eligible. Stop them right now. And they'll go, no, don't worry. And you say, no, stop them. And you have to sort of force somebody to do that. Otherwise, you end up with this huge overpayment. But the other caveat is to be aware when you're being overpaid, and put that money aside. It's not your money. Somebody's just giving you money that you have to pay it back. So that's the other thing to be super aware of, and that there's almost no way to get around that. Sometimes you can ask for a waiver or a reconsideration if you can prove that you were following all the rules, and the error was somehow on Social Security's part. Sometimes they'll waive it, or a portion of it. But again, you want to be sort of proactively defensive, if that makes sense.
Mhm.
Assume that they're going to, make mistakes. Assume that they're going to blame you for everything that goes on. So you need to keep really good records of everything that's going on. Maybe have some little folder or take photos of every single, letter you get from Social Security or your paycheck stubs, and keep that stuff in one place, because they will ask you. Sooner or later, they'll say, what's going on with this? Tell us about that. And it's way less stressful to deal with if you go, and you just go get your, folder that has all that stuff. You just walk in there, throw it down, in front of them. And a lot of times, if your records are better than theirs, they're just going to throw up their hands and wave it, because they have to pay somebody to do that. So, that's some of the equation, is that they're, well, is it worth it for us to pay our employee to go through this stuff for months and months and work it up to where, so again, like being, proactively defensive something is the best course of action if you can do that.
So I would just add a couple things to that. For SSI, I think one of the most important things, since your income impacts your benefits 2 months later, I think it's really important to plan for what that's going to look like. So if you know that wages are going to be pretty consistent, make that part of your budgeting as far as what you have available to you. If wages aren't going to be consistent, you need to maybe save a little bit to make sure you're planning for what's going to happen in 2 months. Because the other piece to that is, if employment stops this month and you get paid this month, that money that you receive this month is still going to impact you 2 months later when you don't have wages anymore.
Right.
So I see that happening a lot. I didn't mention in the beginning, but I also manage our substitute payee program. So my staff are responsible for reporting wages and getting benefits in place and making sure Social Security is doing the right thing with benefits, SSI and SSDI. And as Geoff mentioned, for SSDI, it's much, much harder, because many times Social Security will say, oh, no, it's okay. You're on SSDI. We don't care. You're fine. You're not making that much. But if you go over that trial work period amount and you're consistently doing that, they're not consistently reviewing that disability case. They will, however, at some point either get an IRS alert that you're working, and that could be a year to a year and a half after the fact. And then you're hit with all of these overpayments, $15,000 to $30,000 worth, if you weren't reporting that income on time. And really, as Geoff also mentioned, really advocating for, look, I know I'm making too much and I don't qualify for this amount anymore. Please stop sending me money. Which seems like an odd thing to do, but it's better to stop it right away than have it accumulate and have a very large overpayment on your hands later.
That's a great point, Renee. And I've often wondered, so what does someone do when they know, hey, there's no double dipping here. I don't get to keep all of my SSI and all of my paycheck, yet I have both of those in my pocket right now and they're burning a hole. Like, what do you do with that money? Can you just send it back to them? Can you write them a check and send it back?
That's hard too, because if you send it back to them, they're going to say, well, wait a minute, you don't have an overpayment on your record yet. They send it right back to you. Yeah. So it's a catch-22. In our payee program, what I find is, most importantly, you got to report things on time. And if you see that, okay, this person is now going over that SGA amount, and we know they're at month number 8, get on the phone with Social Security and say, hey, I'm on month number 8 of my trial work period. Please look at my case. Start really just being vocal about it. That's really the best thing you can do. There are going to be, especially if you're on SSI, you're going to have overpayments when you start working. It's just inevitable. It's always 2 months behind, but it's going to happen. So you're going to have to kind of plan for that too. SSDI is where I see the really exorbitant overpayments that are just unmanageable, and a lot of times such a shock to people, because we didn't know they were working. They didn't say they were working. And now 6 months to a year has gone by. So
yeah, and I'll add also that, part of that is because for the SSDI part of it, as I mentioned, you get all of it or none of it. Because of that, for them to stop the benefits is a much longer process. They have to go through this whole thing where they work up your case and to cut you off. So that's part of what's going on with SSDI, is that they have to do this really long process to stop your benefits. Whereas SSI, the amount of cash you're getting is entirely dependent on how much you're working. It goes up, it changes, frequently if somebody's working. So it's already, that system is already set up to immediately be responsive to somebody's engagement with employment. Whereas SSDI, for whatever reason, it has this kind of default assumption of like total and permanent disability, that somebody's just never going to work again and not going to ever make any kind of substantial income. And part of that is also because this is just some federal average, the substantial gainful activity amount, and it's stuck in the 80s basically, in their assumption about what substantial income is. So there's all these kinds of weird things that are just sort of baked into that program because it's such an old program. It's basically goes back to the New Deal era. So it's, predicated on this world that doesn't exist anymore. Whereas SSI is a little bit newer of a program, and because it comes out of the general fund, they don't want people on SSI. So that's why there's more immediately responsive kind of work incentives going on with SSI, that it's facilitates transition in and out of work in a sort of more dynamic way. Whereas SSDI, again, for whatever reason, has this kind of assumption, that's kind of this different era, like you were some skilled, machinist or something that lost your hand in an accident, and then, that's it. You have no more possibility for working. So there's this kind of weird ideas that don't make sense. And I think a lot of that has to do with why SSDI is just so slow to respond to changes, and it can result in these just disastrous, like huge overpayments that are, incredibly stressful. When somebody gets one of those, it's like, oh my God, I owe $40,000, I don't have that money. But these overpayments also, it's good to keep in mind that the debt to Social Security is not like debt to a credit card company or something. Like, they'll work with you, because every single one of us is going to be on Social Security sooner or later, whether that's retirement or SSDI or SSI. So they know they can get it back from you, even if they have to wait until you're 67, and you go, and then they say, well, we're just not going to pay you because you owe us, a lot of money. So it can be kind of negotiated with them, and they're not aggressive kind of in the way that some other debt collectors will. So that's, I often tell clients, I know it's super stressful, but take it with a sort of grain of salt, that and they're always form letters too that are designed to be kind of alarming. The language that they
And don't make sense
and
usually.
they don't make sense at all. And so it's designed to kind of evoke some kind of like immediate reaction. I'm sure somebody was designing the language for that reason, to like, cause alarm in people. And but they are form letters, because I've seen thousands of them, and they look like, they're personally addressed to you, but they're not. They're almost identical to everything. And it's amazing that they're able to do that, to make it seem like it's a personal thing, but it's not.
Okay, so and if somebody does get one of these letters and it says you owe a couple $1,000 and you just don't have that money, what then?
So if you're
Is
still
everything going to
receiving-
fall apart? Is it the end of the world?
Well, it's stressful for sure.
For sure, right? Mhm.
Yeah, if you're still receiving benefits for SSI, what they will do is they'll deduct 10% monthly off of your benefits till you pay that back. If that is a hardship for someone, you can also negotiate for that amount to be much lower. You could say, you know what, I can only do $20 a month, sorry. And usually they will do that. We do that for our payee clients all the time. For SSDI, unfortunately, they will just take your full benefit amount sometimes. So there really is no negotiating on that one. I think probably because it's a much longer process, like Geoff mentioned, for benefits to stop if you're on SSDI. And by the time that happens, you probably don't just have a couple $1,000s of an overpayment.
No.
You have tens, $20,000 of an overpayment. So hopefully that doesn't happen. But yeah.
Yeah, and again, like the way to, they're going to do it at their own time, but you can prod them if you're insistent, but don't be rude about it, because, obviously, like Social Security agents are dealing with people screaming at them all day long. Where's my benefits? So, be gentle and kind to people, but insistent. If you need to go in there once a month and go, hey, stop my benefits. Hey, stop my benefits. I just talked to you. You keep paying me. Stop doing this. That will sometimes kind of light a fire under somebody, and they'll go, oh yeah, I gotta, do this, because again, it's work for them. So, the sooner that you can get them to do it, it's easier for them, because then there's less months that they have to do all these calculations about your income, and if you have any kind of work expenses that you can deduct from that, and so it's a complicated bureaucratic process.
I would also say use their terminology. Tell
Yes.
them, I know I went through my trial work period last month. I'm done. I've done 9 months. Please stop my benefits. Use their language, then they know you're paying attention. They know that you know what you're talking about.
They'll definitely take you more seriously if you use their exact term. Like, so use this substantial gainful activity. Go in there and use that, or even the acronyms, even better. Just, say like, hey, I made over SGA, and then a little eyebrow will raise. They're like, oh, this person actually, unbelievably read the rules, that like was buried in the red book or something like that.
Bring your red book with you.
Right. Which is extremely rare, that like anyone on these benefits knows anything about them. So if you come in there, in a sort of quasi-professional manner and say, hey, as if you were talking to your insurance agent or something, then they're going to respond in a more helpful manner, and you're going to have a better rapport with them. Then they don't assume that you're just trying to get around these rules, or so yeah, I usually give advice to my clients, like, okay, use this line, say this exactly when you walk in there, and that typically does kind of smooth the process, and there's less antagonism going on.
Right, we've got about 5 minutes left, and Renee, I do see your question. We're going to get to that. Georgetta, I see your comment, and just to summarize what Georgetta said in the Q&A, this is all the SSI, SSDI, the rules, the regulations around these programs are very, very complex, and almost can seem as like a disincentive to go back to work, and there just aren't enough, as you guys said earlier in the presentation, just not a lot of resources available as far as work incentives planning and benefits counseling out there. The DOR has the whip. Know of any resources that somebody who might not be connected to a supported employment program can access?
I would say look for nonprofit legal groups.
Yeah.
So like for Alameda County, we have Bay Area Legal Aid. They're wonderful. Center for Independent Living, wonderful. That would be my suggestion.
Yeah, and it's true, and basically, one thing that's interesting is that almost everybody I talk to about the sort of lay people about benefits is they always assume that these programs are more generous than they actually are, and that's very telling. That like the average person on the street is like, oh, it works like this, and you're like, no. There's way more sort of really limited kind of asset limits going on. There's means testing, and so yeah, there's a disconnect, and so all these comments are totally correct about there. In many ways there are a lot of disincentives to work, but a lot of that is just because just the disconnect between the actual like real cost of living and contemporary economic reality for people versus the ossified kind of assumptions that are baked into this kind of legislation from decades and decades ago. that doesn't change. And, as we know, like it takes governments a very long time to catch up with what's happening in contemporary situations. So that's basically like what the core of the problem is. And, removing or changing these asset limits and this means testing would be the immediate kind of way to simplify this whole process for people, that they don't have to try to, basically remain in poverty to stay on these benefits. But, that's also the contrary point, is that, yeah, $1,040 a month is not enough is not even close to being able to pay rent. So, that makes a situation where people on SSI have to work also. So then these kinds of skills about navigating the rules are essential, that everybody knows that. And yeah, it's surprising to me that there aren't more benefits specialists to help people navigate this, because
Absolutely. And Helen put in the Q&A, don't forget about Disability Rights California. That is a great online resource, right? I think they even have calculators there where you can plug in numbers just to get a general sense of how income can affect your benefits. So thank you for that, Helen. And I just want to sort of just drive home the point that, the benefits, it's such a complicated, it's just so complicated to navigate through. And there's a reason why employment specialists aren't meant to be experts in this arena, just because it's just so much information. We really have to rely on the experts, on the people who've been trained, on the people who've been doing this work to get that expert consultation and counseling. And there really are some best practices around that for people in supported employment programs. We want to make sure that when people are just thinking about going back to work, we're linking them up with a benefits counselor. When people start working, we're linking them up with the benefits counselor, because now we know exactly, okay, this is how much you're making, these are the hours that you're working, this is how your benefits are going to be affected. And as situations and the conditions change at work, if there's some seasonality and it's Christmas time and now we're working overtime and folks are getting more money, we want them to consult with the benefits counselors. People get raises or promotions, we want them to consult with the benefits counselor. So it's not a one and done thing. We want this to be a continuous conversation there.
Yeah, that's something that I would add, is that a lot of the services that I provide are sort of ongoing with the same people. So rather than giving a presentation like this and going into all the super details, I'll just sort of ask somebody, okay, what's going on? You're working, how much are you making? And I'll run the equation for them and go, okay, this, and then I'll give them instruction, go report this, and then call me back. Something changes, call me back. So it's sort of a longer term learning process, so that they learn how to interface with Social Security before it becomes some massive, impossible problem to solve. So rather than this big thing about my benefits, just deal with it kind of on a case by case thing. Okay, you have more than $2,000. We need to take a certain amount of that and go do this with it. Your income, you need to report your wages. Okay. And I'll run the equation and tell them, this is exactly how much less you're going to get from SSI in 2 months. Prepare for it. What are you going to do? So it's a lot of those kinds of things that make it less of a, monumental problem, and become more like sort of parted out into small, more manageable tasks. And when you do that, it only takes a few minutes every month, really, to do these things, rather than a week, months later, that you have to spend going back. Oh, I got to go over to the Social Security office. I got to go to social services. Now I got to go over here. I got to report this. I got to go print this out. And I got to, and because that's exactly what happened.
Yes, thank you for that, Geoff. I didn't mean to open up a can of worms around, the pitfalls there, but I also don't want to, minimize, the potential fallout. If people are not intentional and proactive around, the benefits aspect and the reporting of income, these are all things that are very, very avoidable, if you just plan for it upstream. Okay, Renee, we're going to get to your question here, and then this is the last one, and we're going to transition to a break. Renee says, I've heard, and this is the rumor mill going, I've heard that due to the pandemic, SSA is going to estimate the amount of earnings because the staff did not or were not able to keep up with earnings reportings. If this is the case, what can consumers do to protect themselves?
So I can definitely touch on this a little bit as the manager of the payee program. Estimated earnings for SSI is not a new thing. They've always done that if they're not getting wages reported timely or completely. So say you report your wages 1 month, you don't report them for the next 3 months, they're going to then estimate what they think your wages have been, and they're going to go as high as they can possibly go to basically prevent issuing benefits that are too high. So really the only way around that is to prove what you were earning during that time period. The other thing Social Security will do is if you've never reported any wages, and for SSI, especially when they get an IRS alert 6 months to a year after the fact, and they see, oh, you have employment history here, that IRS alert is just going to give them quarterly amounts that were made. So they're going to divide that out and assume that you were making the exact same amount every month. And again, that will then create overpayments that may not be true, because maybe 1 month you made $1,000 and maybe for 2 months you only made $200 in each month. So estimated wages are not a new thing. I do know that during the pandemic, they were not developing overpayments for a very long time. So I don't think they're going back and doing that now for that time period, but they are now becoming more aggressive with taking a look at different cases and seeing if there's anything that may create overpayments at this point. If you have anything to add to that, Geoff.
And that's also the case, incidentally, for like Medi-Cal. They're also suspending these the redeterminations during the sort of public health emergency. So there's many people that probably got away with making too much money for the past couple of years and maintained free full scope Medi-Cal that maybe should sort of prepare to have to respond to that. Because they're starting to send out these redetermination forms again.
You definitely want to keep up on the redetermination, because they will discontinue cases very quickly now.
Yeah.
Those are starting.
And then, just the other kind of thing to mention related to what Renee was talking about. So if somebody, is self-employed, for example, or independent contractor or something. So like the way they deal with income in that case usually is like you're paying your taxes once a year, usually. So they will just sort of take your yearly income and prorate it, so they'll just divide it by 12 and then assume, that's your monthly income, and then adjust your SSI based on it. So that's kind of, similar to the way they're dealing with a situation where somebody's kind of failing to report income on a consistent basis. They're basically doing the same thing. They're just sort of doing a prorated calculation.
And I just want to be cognizant of the time here. We're eating into our break. The next panel discussion is coming up at 10:25, and that's going to be around launching IPS programs and funding and billing sustainability. So if everyone in the audience needs to take a break, now is a good time to get up, stretch, bio break, do all that. Come back at 10:25. Geoff, Renee, if you don't mind, for folks who are willing to stick around for a minute, I want to leave us on a high note. Can you very maybe succinctly share with us a client success story, one that just kind of comes to mind? That one story, you get the highlight, you tell everyone at the barbecues when they ask what it is that you do, this is the story you share.
I would say for me, I have I have more than I would expect to have as far as success stories go. So I won't pick one in particular, but what I really love is when I see our payee clients go through the whole system of benefits. They start on SSI, they start working a little bit, and they're doing really well. They're getting both benefits. Then eventually they're working a little bit more and they're paying into now Social Security benefits as well. And lo and behold, they end up eligible for both SSI and SSDI. And they're still working enough that they're keeping their benefits going and their SSDI starts to increase. And so once their SSDI increases and makes them ineligible for SSI, now they're getting a nice larger amount above the federal poverty level for SSI. And they're maintaining that for a little while and still being employed. I've also seen in those scenarios where then somebody goes through their trial work period and is making even more, and eventually will go through their extended period of eligibility, and now they're no longer determined disabled because they're making enough money at that point, and they come off of our system completely. And during that period, they've also learned financial independence. They learn how to budget their own money that they're getting every month. They've learned how to pay their rent and pay their bills and make sure that they're maintaining their benefits and reporting the things that they need to report. And they come off of our payee program as an employed individual out there doing great and living independently. So those, I would say I have at least in my 17 years with the payee program, 10 to 15 clients that have met that scenario, which is really great.
Yeah, I would say, similar experience. I've had a few clients that have transitioned, from being on benefits slowly to slowly increasing their work activity. And, I should mention, I do mention this frequently to clients that are on SSI. I'll say, any work at all you're doing is positive because you're paying into Social Security, because you don't want to be on SSI when you're 67 years, particularly. And, it's going to make you eligible for SSDI and retirement eventually. So, that's kind of the point, is it doesn't have to be like you don't work at all, or you're, full-time employee making $100,000. There's many places in between that are moving you in that direction. So, for most of our clients, there's going to be a sporadic kind of work activity, because they're dealing with, a lot of circumstances that other people are not. But that's okay, because every time somebody does, engages with some work, they're paying into Social Security, they're learning some skills, they're having some experiences that sort of reduce kind of anxiety around going back to work. So in many ways, that kind of fluctuation actually builds a kind of resilience and sort of ability to kind of adjust your situation. And that's a really, really important skill for somebody with a disability, is to be responsive to kind of whatever's going on with them. But moving that direction to where you have access to SSDI or retirement, where there isn't this savage means testing around, that's this enforced poverty, that's what you want to do. You want to go that direction. So any time that you're helping anybody work a little bit, that's serving that purpose at the very least, is moving that person into in the direction of not being forced to have less than $2,000 a month, and no more than around $2,000 in income per month. You can move that direction.
Well, thank you very much, Geoff. Thank you, Renee. We really appreciate you guys coming on and sharing, this well of information with us for everyone.